Welcome to InfoT. Today we will explore telehealth and occupational therapy. First of all, let's begin with two important definitions. Telehealth is the use of electronic information and technology to provide health-related services remotely. On the other hand, telerehabilitation is the delivery of rehabilitation services to people with disabilities using the telehealth technology. Occupational therapy via telehealth can help clients with developing skills, incorporating assistive technology, modifying environments, and creating healthy lifestyles. Telehealth has many benefits. It is accessible for clients that live in remote areas. Usually, there are no delays in receiving care, and there is access to therapists that otherwise were unavailable to clients. There is flexible scheduling, and it is a time saver. Usually, it's less expensive than other one-to-one therapies. There are disadvantages, of course. Teleservices are not always reimbursed. Confidentiality and privacy are not always ensured. The therapist cannot respond immediately to a potential crisis, and there are technological bugs that can disrupt the therapeutic process. The most common area of practices in which occupational therapists intervene are the following: children and youth, productive aging, health and wellness, mental health, rehabilitation, disability and participation, work, and industry. With children and youth, early intervention and school-based services are used. In productive aging, remote assessment is viable for clients that can easily move. There is also the possibility of managing obesity and other chronic diseases in order to promote health and wellness. In mental health teleservices, the therapist promotes participation and psychological and social functioning through meaningful engagement. Access to these teleservices for mental health is easier since many barriers are lifted via teletherapy. For example, clients don't need to travel, the fear of social stigma is minimized, and cultural issues are not a barrier anymore. Assessment and recommendations for durable medical equipment, home modifications, and assistive technology are easily incorporated. In work and industry, therapists can remotely assess and analyze workspaces to prevent injuries, analyze workstations, make recommendations for modifications, eliminate risk factors, and promote health. The outcomes of telerehabilitation in occupational therapy are the facilitation of occupational performance, increased adaptation, health and wellness, prevention, and quality of life. Some general consideration regarding the client's comfort and competence. If there is someone else in the room with the client, then the client might feel uncomfortable and change behavior. In addition, the client needs to be comfortable with and competent in using the technology. Some considerations about the therapists. They also need to be technologically competent and use appropriate equipment of good quality. They also need to have an alternative plan in the event of equipment malfunction. All information in this video was found here. Thank you for watching InfoT. If you liked the video, feel free to like and subscribe. Stay tuned for more.